2-3 years. And it is good for patients who, let's say, heart failure with a procedure around the high risk procedure out of the and it's also fine, I think, if someone is really resistant to having the colonoscopy. Other than the NNA, it's kind of like a kit. You take the kit home, you take a sample of your stool, use it on a paper, and then bring it back basically to the physician. And results on the it is not 100% accurate. In a colonoscopy, the GI physician is taking the scope and looking with a camera at all the polyps and everything. So it's not going to evaluate all the upper colon cancer issues. It can pick up on bleeding, which is usually lower colon. So it is not 100% accurate, but it's about 90s, 95% accurate, so it's probably fine, especially if you don't have a family history.
Regarding this depression, you said it's not clearly visible, right? So what criteria that doctors have when they can come and say to you, say, I'm very depressed. So how do you determine whether that person is actually going through depression or not?
Oh, okay, that's a very good question, and that's where many people struggle with too. So, one thing I have to say is psychiatry is not advanced. The technology, we don't have like markers in the blood or like and doing a test to find out. So most of how we determine how if someone is going through depression is through clinical interview. We talk to the patients. So a typical criteria for depression for more than 2 weeks. If you're someone who has been like happy-go-lucky, you're functioning well, you're able to do your work well, you're able to focus on your work well, and then for more than 2 weeks you're like sad for most of the time, nothing is making you happy despite everything being okay around you. You lose interest in things, or if you had hobbies, like say if you were a singer, you suddenly don't want to sing, don't want to cook, like if you're someone who likes cooking, unlike me. You're not doing things that you usually do. There is a loss, you feel hopeless, you feel life is not worth living. And there is also functioning affect. First, வந்து தூக்கம் affect ஆகும், நிறைய தூங்கலாம் இல்லாட்டி கம்மியாக தூங்கலாம், தூக்க குவாலிட்டி வந்து நல்லா இருக்காது, தூங்கி எழுந்திரிச்சு ஒரு ஃப்ரெஷ்ஷான ஃபீலிங்கே இருக்காது. அப்புறம் வந்து சாப்பிட்றது கம்மியாக இருக்கலாம், இல்லாட்டி நிறைய சாப்பிடுவாங்க, நான் சாப்பிட்றதோட நிறைய வேணுன்ற மாதிரி இருக்கும். ப்ளஸ் அதுக்கப்புறம் ஃபங்க்ஷனிங்கும் போது நம்ம வந்து யூஸ்வலாக வந்து சே ஃபார் எக்ஸாம்பிள் ஐம் டேக்கிங் அப் கம்யூனிட்டி பார்ட்டிஸ்லாம் வரவங்கள ஒரு ஆளாக இருந்துக்கலாம், சடனாக வந்து தே ஸ்டாப் கமிங் டு எவ்ரிதிங், லைக் தே ஆர் சோஷியலி கெட்டிங் withdrawn, நாட் இன்ட்ராக்டிங் வித் ஃப்ரெண்ட்ஸ், நாட் டேக்கிங் பேக், not taking care of household work that they were usually doing. So it's affecting their functioning. So that's when we call it as depression per se. That's when it goes beyond the usual sadness or stress in our life. When we're able to function, like we have sadness, we have stress, we have anxiety going on, but when it starts affecting our functioning, our day-to-day, our full capacity to function, that's when we call it as depression, and that's when we refer to, and depending on the severity, it could be treated with just counseling or therapy, or we need medications on top of it to help one get through that. And one important thing is, there is this notion that all these medications are addictive, they're going to make you like a zombie. It's not like that anymore. That was back in the day. We have good medications that let you function, and it's not going to make you addicted to any substances.
Thank you. You can also share any experiences that you've come across with your friends or family that pertain to cancer or mental health.
Soumya, this is you. இப்போ வீட்டில் பெரியவங்க வந்து டிப்ரெஷனில் இருக்காங்க, 70+ இருக்கிறவங்க டிப்ரெஷனில் இருக்காங்கன்னா கூட இருக்கிறவங்க எந்த மாதிரி அவங்க நடந்துக்கணும், எந்த மாதிரி அவங்க கிட்ட வந்து பேசுறது, அவங்களோட இன்டராக்ஷன்ஸ் டே டு டே எப்படி இருக்கணும், அவங்க எப்படி ஹேண்டில் பண்ணணும். பிகாஸ் தே ஆர் டேக்கிங் மெடிகேஷன்ஸ் ஃபார் டிப்ரெஷன், டாக்டர்ஸ் பார்த்து கன்சல்ட் பண்ணி தே ஆர் தட் ஸ்டேஜ். ஸோ அவங்க கிட்ட கூட இருக்கிறவங்க பிகாஸ் அவுட் ஆஃப் நோ டைம் தே கெட் anxiety வருது, நேரம் வந்து they're completely different person.
it's very important that they follow up with their psychiatrist or their therapist. So that is very important. Because people say நம்ம ஃபேமிலியில் யாராவது இந்தியாவிலேருந்து இங்கே வராங்கன்னா it may be difficult for them to access their psychiatrist, especially if they are here. So இப்போ வந்து அந்த telehealth அந்த மாதிரி இதெல்லாம் இருக்கு. So those are some things that you can use from here. Next வந்து அவங்க தூங்குறது அது வந்து sleep is a very important aspect of management of depression. Helping them to sleep. இப்போ வந்து நிறைய வயசானவங்க வந்து நைட் டிவி பார்த்து அவங்க ஸ்லீப் யூஸ்வலாகவே ஒரு மாதிரி ஸ்கேட்டர்டாக தான் இருக்கும். On top of that, if they are suffering from depression, the sleep becomes very important, and it's very important that you help them go through the sleep. Like night வந்து அவங்களுக்கு extra maybe giving them a quiet room, those kind of things. Second வந்து if you can look for the triggers that usually trigger them, like when they are depressed, what is there a pattern to what makes them upset at home, and just talking to them about say iduna upset ungalku adu upset pannudna, just having a conversation with them like how you can help them, because each person is very different. Like person A with depression will not resemble a person B with depression, will not resemble a person C with depression, because ஒவ்வொரு ஆளுங்களும் அவங்களுக்குன்னு ஒரு லைஃப் ஸ்டோரி இருக்கு, லைஃப் ஹிஸ்டரி இருக்கு, சர்க்கம்ஸ்டான்ஸ். So I would say like talking to the நம்ம பெரியவங்ககிட்டயே பேசி எனக்கு தெரியுது நீங்கள் கஷ்டப்படுறீங்கன்னு, how can we help you அப்படின்னு ஒரு டைரக்ட் கான்வர்சேஷன் அவங்ககிட்ட இனிஷியேட் பண்ணுறது and letting them lead you to help you will be more important, I would say. Does it answer உங்கள் question answer பண்ணுச்சு எனக்கு தெரியல.
Thank you.
I want to share a story actually. I think I've contacted you before that, especially depression part, right? Everybody goes through depression, and it's different forms, depression, and it's very hard to identify depression. But depression in a child, and I think that is very crucial as a mom, you would not know that your child is having depression. Sometimes I get very emotional talking about this because I have recently had situations, a friend of mine went through. ஒரு குழந்தை நம்ம கிட்ட வந்து சொல்லுது, அம்மா நான் ரொம்ப எனக்கு ஸ்கூலுக்கு போகவே பிடிக்கல. The person is very happy and bubbly. But as a mom, நம்ம என்ன சொல்லுவோம், உனக்கு என்னடா இந்த டைம்ல இருக்கு, just go have fun, everybody will be nice to you. But you really don't know what the kid is going through behind it. And then and later you see a pattern in the child, like doesn't want to go and social things with his friends, always want to be home, always locked up in the room, not sharing details about anything. And that is a sign your kid is actually talking to you, and number denial as a parent. And it happened to a close friend of mine, and that kid was literally hurting herself. And the mother starting her body and scratches her, like where you get it? No, I hurt you. So the kid went through depression, started hurting he or she. And the mom finally, okay, something is wrong. And when I was having a conversation with her, I said, you know what, she's going through depression. Reach so and so, go for help. The first thing the mom is denial. The one thing as parents we go through, or anybody, even if you are depressed, denial is the first thing. I'm not depressed. You are crazy. I'm not. That is denial. The mom was denied. And when she reached out to later, and I'll take, what if they take the child away from me? That is secondary. That is the least thing you need to be worried about. Survive, help that kid, So as a mom, and as I was saying, as a mom, be there, listen to your kids. Depression can happen at any age, and I remember even my son talking to me about things. Be the listener. Do not cut them off. Do not stop them from expressing it. And apparently, she also talked to you, and the kid is actually, in therapy and everything. And yes, they took the kid away for 5-6 days from the parents, but the kid is absolutely fine now, But I just wanted to share the story, so please.
Thank you for bringing this up. So, I didn't go into a lot of details, like depression can affect children, teenagers, adults, geriatric patients. So each one presents differently. Kids especially, Patina, like mentioned, it's very important to have the channel of communication with your kid because all kids are different. Like my kid is not the same as another kid who's her age. Like they have their own temperaments, their own likes and dislikes, what they like, what they don't like. So, at least from my now, I don't know if it's applicable here, but when I was growing up in India, it was always comparison. அந்த புள்ள பண்ணது நீ ஏன் பண்ண மாட்டேங்கிற அந்த புள்ள ஃபர்ஸ்ட் ரேங்க் பண்ணுது நீ ஏன் பண்ண here it is not that bad at all, but that comparison நம்மளே சொல்லலாம் கூட அந்த குழந்தைகளுக்கு மனசுல இருக்கும் நம்ம ஏன் அந்த மாதிரி பண்ண மாட்டேங்கிறோம். So having a channel of communication, let the kid know that this home is a safe place for them to talk and express is very important so that we can like get them help. School ignore issue on the bullying. Our kids, if suddenly a good school suddenly school denial, they are refusing to go to school, they are avoiding to go to school, saying like their stomach physical complaints, so that you check it out, it's fine. One thing that we need to look at is what is happening in school. Talk to the teachers, reach out to the teachers, talk to them to see how the kid is in school. So I think having that channel of communication, knowing the small differences and the withdrawals, sleep, தூங்காம இருக்காங்க நல்லா தூங்கிட்டு இருக்க குழந்தை திடீர்னு தூங்க மாட்டேங்குது சாப்பிட மாட்டேங்குதுன்னா நம்ம as parents we are the first line for them to get that help that they need.
Thank you. All right, any more questions? Questions if you don't have if you have a personal experience like Neil's patient.
Hi, so I'm Sugandha and I'm actually a pediatrician as well. That's why I wanted to just weigh in on what Soumya was talking about. In the past 2 years, we've been through the pandemic, and the American Academy of Pediatrics has actually announced a national emergency in relation to children's mental health. So ERs across the country have been flooded with children who are suicidal and facing a lot of mental health issues. So in the topic of every community in this country, it is very important to be discussed. And also, just like Soumya was mentioning, யாருக்கும் எப்போ வேணாலும் வர ஒரு சிச்சுவேஷன் வந்து டிப்ரெஷன் இருக்கு. அதனால அவேர்னஸ் இஸ் கீ அண்ட் பேசணும் இதை பற்றி ஜாஸ்தியாக. அவ்வளோதான்.
Any other questions? Because after this we will move on.
Well, it's not a question or anything, just something to share. One of my close friends, she kind of went through a stage. I should put a stage because I know she's being aware. The way she thinks is everyone is harming her. So எல்லாருமே அவளுக்கு இருக்கவே மாட்டாங்க அப்படின்னு. So நம்மளே பேசுறப்ப வந்து it definitely sounds absurd. ஏன்னா அது மாதிரி நடக்க சான்ஸே இல்லை. சில பேர் வந்து நம்ம நம்பலாம் அப்படின்னா she won't stop. She won't talk to us. அப்படியே shut off. So slowly we went along with her. Okay, இதுதான் நடக்குதா நான் விசாரிக்கிறேன் என்ன பண்ணுன்னு பார்க்கலாம். So slowly வந்து she kind of came to like அந்த மாதிரி situation.
It's very, that example shows that support is very important in someone who wants to mental health. So, another aspect of psychiatry I didn't talk about was the schizophrenia, bipolar disorder. Those are like disorders that really need it becomes very obvious. Like they start thinking that people are trying to hurt them, hearing voices, and if those kind of symptoms happen, the patient has to go to a psychiatrist because they need to be started on medications and. It's so being available for them, just to be that support system for them is also very important. Another females, I forgot about this. Postpartum period is a very crucial time when depression can happen. Immediately after childbirth because of the hormonal changes that our bodies go through. Another time is postmenopausal. Again, the hormone. So those are very two unique situations as females that we need to be conscious about. Oh, it's because I'm not sleeping through the whole night, that's why that is postpartum blues. It's very different from postpartum depression or other postpartum psychosis that can happen. So நம்ம ஃபேமிலியில் இந்தியன் இதில் வந்து அதெல்லாம் ஒன்றும் இல்லை, நீ வந்து அதெல்லாம் பார்க்காத, நீ வந்து குழந்தை ஃபோக்கஸ் பண்ணு அப்படிம்பாங்க. பட் it's also like it's something beyond that. It's not just tiredness, you know, like you don't, it can affect the bonding with the child, it can affect like how you look at the child. So if even if it's not depression, you feel different from your usual self, go talk to your primary care or your gynecologist. They usually